Hello everyone, welcome to today's Elsevier Live Educator Edition webinar on educating nurses meeting the challenges of the Royal Aged Care Commission. My name is Emily Wang and I'm the Marketing Manager here at Elsevier. Firstly, I'd like to start with an acknowledgement of country. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. It gives me great pleasure to welcome our speakers for today's session, Dr. Carolyn Vafeas and Dr. Susan Slatyer. Both presenters are the leading editors of our very first Australian edition textbook, Gerontological Nursing, a Holistic Approach to the Care of Older People, which just published in April this year. Dr. Carolyn Vafeas is the Director of Undergraduate Nursing Studies with the School of Nursing and Midwifery at Edith Cowan University in Western Australia. Also dialing in from Western Australia, we also have Dr. Susan Slatyer, who is the Associate Professor of Nursing with the College of Science, Health, Engineering and Education at Murdoch University. I will now pass it over to Dr. Susan. Thank you very much.
Thank you, Emily, and welcome everybody. And I've been just looking at the chat that's popping up and I'm seeing that we're being joined by people from all over Australia and New Zealand today. And I just think it's wonderful that we're coming together as a nursing community of educators. We are preparing the nursing workforce of the future, our registered nurses and our enrolled nurses. And particularly with the Royal Commission having recently published its final report, I think this is a really timely conversation for us to be having. Carolyn and I edited this textbook for nurses. We didn't obviously do it in response to the Royal Commission, but we were producing the book. There's a lot of work that went into it, of course, as the Royal Commission was playing out and hearing the many hundreds of submissions and hearings. And our book published around about just a couple of months or a month or so after the publication of the final report. So whereas we didn't produce this book in response to the Royal Commission, it is hopefully a valuable resource in as we work together as educators to prepare nurses for the future. So just a little bit about the Royal Commission final report. I'm not sure how much people know, but just a very basic summing up. So when the Royal Commission final report was handed down in March, or February, March, the report, in essence, really recognised the changing demographics of older Australians and how those changing demographics and the increasing rates of comorbidity and disability has influenced the demand for aged care services, and really whether the services, and we're talking about home-based aged care, we're talking about residential aged care, have really kept up with that demand. It also highlighted problems that older people and their caregivers have in accessing and navigating aged care services. And it detailed substandard care in both routine and complex care that is occurring, and it really highlighted 15 areas of particular substandard care. And that was disturbingly high, and that's an issue for us as a nursing workforce. So 1 in 3 people receiving residential and home-based services were reporting poor care and also evidence of abuse, and the very high and the overuse of physical and chemical restraints. So that's a real issue for us. In complex care, when the Royal Commission looked at substandard care in complex care, you can see on the slide there, it really highlighted 3 areas that of specific concern. And 2 of those areas, dementia care and palliative care, the Royal Commission said should be core business for aged care services. Over 50% of all residents in residential aged care have a diagnosis of dementia, and for many older people people who live in residential aged care, that facility is their home, and it is their final home, because many people in residential aged care, that's their final home before they die. So really good quality palliative care and advanced care planning should be core business for residential aged care facilities. And the other area that was became evidence throughout the submissions to the Royal Commission was about mental health and about the workforce being able to identify and support someone with a mental health condition. So they were some areas of particular concern. However, disturbingly, in routine care, there were a number of areas that were clearly substandard. The Royal Commission said that these areas of care for older people should be predictable and reliable and of good quality. And if you have a look at those specific areas there, that's really quality basic nursing care. So very much an issue for us as a nursing workforce. So when the Royal Commission made some recommendations, it really has called for a complete overhaul of the aged care sector. It has called for a replacement of the Aged Care Act to be replaced with a rights-based legislation that recognises the right of all older people to receive good quality care, and strategies to complement the formal provision for aged care to ensure that we have age-friendly communities and that we foster more positive attitudes and beliefs about ageing in society. So what can we achieve? We, as the educators of the future nursing workforce, we can't overhaul the aged care sector. We can't bring in new legislation. But what we can do is we can ensure that our nursing workforce of the future is skilled and compassionate and empowered as clinical leaders and also as advocates for older people. The other thing that Caroline and I thought about as we were developing this book, a lot of placement into aged care is a fundamental part of nursing practicums. Often it's the first placement for first-year student nurses because it's a place where basic nursing skills can be taught and learned. And our question is, well, if the skills and training are lacking in aged care services, what are our students learning on those practicums? So this book was really produced to, we targeted to the undergraduate nursing student cohort, but I've been using it in one of my postgraduate gerontology grad certs, and it's suitable for that. We also see that it has application for employed nurses who are working in residential aged care. And the way that we wanted to present it and formulate the book is that so that information is easily accessible. So we've used lots of bullet points and we've used lots of text box so that nurses and student nurses can really pull out the information that they need. So just a couple of little points about this book before we just sort of show you how we think the chapters and the information in the book can really help us to address those specific areas of substandard care. We purposely titled this book Gerontological Nursing rather than Aged Care Nursing because we see that the care of older people is complex and it requires a comprehensive approach, a holistic approach, and we believe it's a specialty in itself. And we titled the book accordingly. So it's probably a new term for some nurses in Australia. It's used a lot in the US. So gerontology is multidisciplinary. We're looking at nurse-led gerontological care in this book. We also ensured that the book covered the continuum of care settings for older people, so acute care, residential care, community care, and transitional care. So we really looked across the whole gamut, and also looking at rural and remote nursing as well. It's very much tailored to Australia and New Zealand, and we ensured that We gathered current resources, practice resources. So everything is current and everything, well, at the time of printing, which was March this year, lots of resources in there for student nurses to be able to access to gather information. We have dedicated chapters to those 3 areas of substandard care and complex care. So we have dedicated chapter to palliative care. We have a very comprehensive chapter on mental health, and we have a dedicated chapter to neurocognitive disorders, which includes dementia. And the other thing that we did was we gathered experts in the various areas from all around Australia. Not all are nurses, but all are healthcare professionals who are expert in their field. And the other thing is that we understood that working with older people can be very daunting for students. And I know this from one of my research projects where we worked with students who'd been into a first-year aged care placement, and they came back afterwards. We ran some focus groups, and what they found most difficult in their placement was how to communicate with someone with dementia. So we've ensured in these chapters that we have put in very practical strategies that student nurses can use, communication strategies. So how to communicate with someone who has a hearing loss, how to communicate with someone who has cognitive impairment or dementia. And we've also provided information around non-pharmacological strategies, so things that student nurses can use, and basic care. So essential terminal care. These are things that student nurses can use without needing to be reliant on the registered nurse to get the medication. Yes, of course, they have to learn about medication, but it does empower student nurses as well. So we were we really wanted to make sure that we had made that very usable for the students. I don't think there's anything else I can really sort of say as an overview. I think probably what we'll do now is we'll have just give you some glimpses of some of the chapters, and then we're happy to take questions and have a conversation, which is so timely at the moment. Okay, Caroline, over to you.
Thank you, Sue, and welcome. Welcome from sunny WA, COVID-free, but we do realise that you're all doing it tough over in the East, so please stay safe. I'm going to introduce some of the chapters that are relevant to the Royal Commission, and so Sue took charge of so many chapters and I took charge of the others, and that's how we worked so well together. We had 29 fantastic authors, and some of them were ourselves, but mostly we had experts, as Sue suggested. And so once again, I'd like to thank them for the absolutely fantastic effort they put in. I'm going to start with chapter 10, infection prevention and control. And that was Norman Davis. And Norman is not a nurse, but he works, he was a consultant in infection control within an aged care organisation. And so we start each chapter with learning objectives. And these are just 4 or 5 bullet points on what we expect to achieve by the end of the chapter. So this is what we gave to, we suggested to each author. Please work out what it is that you think that where your knowledge is, and this is how we'll work through it. So you can see here we've got a research highlight, and that was very, very timely because Norman managed to put in a huge scenario there all about COVID. So the book is totally really up to date. The other things that he's talked about there is promoting wellness, standard precautions. So the students are encouraged to look at, the basic things as well. Within this chapter, we also, of course, the very serious issue of hand hygiene, age-related changes in the immune system that affect infection for older people, and the common infections that people are likely to be susceptible to are also covered. One of the issues that Norman talks about is the issue of presenteeism. And as it says there in the research highlights, it's reported that between 14 and 23% of healthcare workers in this study in New Zealand worked while they were ill with influenza. So we're hoping that, you know, by highlighting this and making people aware that it really is not a good thing to turn up for work, nobody's going to appreciate you, then hopefully we can make sure that people are keeping patients and residents safe by looking after their own health and not turning up for work when they are sick, because it is a big phenomenon. So the next slide is safe use of medications, and we were very fortunate to have Dr. Andrew Stafford complete that chapter for us. Andrew is a pharmacist with expertise in the care of people living with dementia. Once again, we started off by just having some learning outcomes so that, you know, as an educator, as a student, then you know exactly what the chapter is going to include. So within this chapter, we've got quite a lot of drugs that have been highlighted. So the most popular drugs that older people are likely to be taking. He talks about polypharmacy, age-related changes. Things like pharmacokinetics and pharmacodynamics is gone into in detail. And one of the things that I really like that Andrew has done is all about de-prescribing. That's one of the key issues in this chapter. And that's trying to work with older people to try and reduce the amount of medication that they're taking and how to do that appropriately. So that's really big at the moment. And instead of adding more medications to people with comorbidities, it's to reduce the medication to see what's used. So that's a really useful strategy that's discussed in that chapter. He goes on to palliative care and complementary therapies as well to support his ideas in there. So, you know, really lots of useful things there. And once again, we've got boxes for tips for best practice. We've got some research highlights, and the one at the top there is just showing how he's developed the drugs and how he's speaking about them. Nutrition and hydration. We had a joint effort here from a threesome that were very, so these are all dietitians that managed to put this chapter together for us. And we talked about nutrition as well as hydration. We thought it was really important, especially with the Royal Commission, addressing the issue of malnutrition and dehydration in older people. Some of the highlights of this chapter were oral health in older people. So we cannot underestimate the importance of the mouth and the mouth care for older people, regardless of the setting. They talked about the management for malnutrition and weight loss in older people and strategies, so simple strategies that the nurse can implement to improve these issues. And nowadays we're talking about the issue of obesity in older people. So that's not often addressed in many books, but we felt that that was really important with our current population. So management of obesity, malnutrition, dehydration, and oral health are all covered really well in there. And we've also got safety alert boxes, so that green box at the bottom. So if we find that there's something within a chapter that's really important, we'll put it in a box and call it safety alert, so that people are drawn to that point and will take action. Elimination, we had Dr. VICKI PATTON, who very kindly did this. And VICKI's based in New South Wales, and she's an expert in bladder and bowel conditions. So this chapter gives types of incontinence, and she also explains why the nursing initiatives that you can put in place to improve the situation for the older person. So she goes through all four main types of incontinence, and she also talks about management of nocturia. So what you can do, and the fact that older people sometimes assume that that's a normal part of aging, and she's trying to dispel this myth and give some guidance on what can be done. The chapter also does include catheters and stomas, and she's got some research highlights there. She's also gone into detail on the laxatives and side effects of laxatives that are used. Stomas, and yes, so her safety alert there Sometimes increasing dietary fibre in the older population may increase constipation. So just being aware of these things and practice points. We've got tips for best practice, and of course we've got some research highlights in each one as well. We know that students have got to be doing relevant, up-to-date literature in most of their assignments. So my final one is promoting healthy skin, and ROBYN RAYNER, who's an extremely competent expert on skin, working at Curtin University, has put this chapter together for us. So we started with learning objectives about the age-related changes of the skin and identifying common manifestations. Skin tears, we've gone into detail, pressure injuries, as well as venous ulcers, arterial and neuropathic ulcers. So we've got some nice gory pictures there. We've got the STAR classification for skin tears, and we've got up-to-date and current research highlights for this page. We've got a whole list of current dressings that are relevant for this population as well. So with each chapter, for the academics that are listening, and also for the students, we have put together a weekly chapter worksheet for each chapter. So it just highlights 10 key points that you may want the student to be able to answer questions on by the time they finish that chapter for that week. Now, these can be changed. You can change these as you like, but these are in your extra resources, and these come with the book as well. So thank you, and I'll just pass over to Sue to go on with the next chapter.
Thank you, Caroline. Okay, so falls did come up as a specific area in the Royal Commission final report, but we know that falls are a major issue for older people and are costly in terms of reduced quality of life, but also costly to our health system, which, as we know with COVID, is under pressure. So we have a chapter on falls and falls prevention. This was written by Professor Keith Hill. Keith is he's a physiotherapist by qualification, but he's internationally renowned and very highly published expert in falls, and he currently leads the Rehabilitation, Ageing and Independent Living Research Centre at Monash University. So this is a very comprehensive and up-to-date chapter around falls and falls prevention. And one of the points, a very simple point that he articulates very clearly, which is very valuable for students, is that if an older person confides to a student or a health professional that they are feeling unsteady, or they are feeling that they are frightened they're going to fall, this is a very important risk factor for a fall. So people who are feeling unsteady and concerned about falling will often reduce their activities, so there becomes a vicious cycle around deconditioning, which makes somebody more likely to fall. So Keith really brings out these very current and important points. So you can see there that's been highlighted in the safety alert, and that's certainly something that a student may well pick up in a conversation with an older person. There's also a lot in this chapter around different types of risk factors, and Keith has classified them in a way that's very easy for students to understand. So internal risk factors that might make someone more likely to fall, external risk factors, so what's in the environment around the person, and behavioural risk factors. So very easy for students to be able to conceptualise risk factors. And then he provides in this chapter some up-to-date resources, self-checklists that people can use. So a student could provide that to an older person, and the older person can do their own checklist. There's also links to assessment tools and screening tools, and then the importance of implementing interventions, but closing the loop and evaluating those interventions. And I've put in a bit of text there around post-fall huddles, because this is a fairly new, there's emerging research around post-fall huddles and how they can be used in clinical settings. So really just showing you there that the information is very accessible for students and very up to date. So the next one, now this is a dedicated chapter on palliative care. So I wrote that with Dr. Ruth Way, who is a nursing academic, but her area of specialty is palliative care and end-of-life care. And this chapter is really, as I said, it's dedicated to palliative and end-of-life care. We found when we looked at other textbooks that often that was mixed in with other topics, but we've given this its own chapter. It's really a lot around, or there's information in there around recognising the dying person. So I have adjunct positions at 2 of the large hospitals here in Perth, and I hear that from the senior clinicians and the senior nurses in palliative care that often nurses don't recognise when someone is nearing the end of life, and of course that has implications for symptom management and also for advanced care planning. So there's information in this chapter about how to recognise a dying person, and then what are the elements of a good death, what are the principles of palliative care, and how are they applied in residential aged care settings, which, as the Royal Commission has explicitly said, should be core business. And then there's a lot in there on advanced care planning. I think I've got the surprise question in there. So you can see there, tips for best practice, the second blue one, is about the surprise question. And that's a very current concept that's being used now to initiate advanced care planning conversations. So I include that little graph there because we really made the point in this book that end-of-life care and palliative care is not just for people with cancer. If you look at that, that pie chart there, that shows globally the types of conditions that people have who are accessing palliative care, and cardiovascular disease is the main one there, and then cancer, and then the other diseases. So it's really showing that this is not just about cancer, this is core business for the care of older people. If you look at the, so there's information there about advanced care planning and the components of essential terminal care. As I mentioned earlier, these are things that students can be doing: mouth care, skin care, repositioning, comfort care. So very accessible for students and very empowering for students. We also have a section on voluntary assisted dying, which is very topical in Australia at the moment. So there's some information on that. And we also talk about the decision-making hierarchies around advanced health directives and which ones are legally binding and which ones are more a guide. So it's quite a bit of interesting. Our next chapter was mental health. Now, as I said, we've got a dedicated chapter to mental health. And this is a very comprehensive chapter. It was written by Associate Professor Karen HESLOP, who is a mental health nurse and academic at Curtin University. She has a research program in this area, and she also teaches. So this chapter, as I said, is really comprehensive. So it looks at what is good mental health in older age, and then detailed information on mental health disorders, including depression, anxiety in older people, and there's a lot of information on suicide with safety checklists. And each of those, we talk about the age-related changes, the pathophysiology, underlying mental health conditions, and then non-pharmacological management and pharmacological management. And again, that's very empowering and very important for comprehensive care. This chapter also discusses the influence of culture and the culturally and linguistically diverse communities and people, and mental health. So as I said, a very comprehensive chapter. I mean, yes, it's around older people, but it's probably something that could be used for other age groups as well. But of course, it does have that interpretation around older people. So that's mental health. This is neurocognitive disorders, and this was written with Sheridan Reid, who is just completing her PhD in dementia care. She's also a nursing academic. She's worked as a dementia specialist in one of the large aged care providers here in Western Australia. And she's also worked with a large national research group doing research around the care of people with dementia. We have some books will do what they call the 3Ds, so depression, dementia, delirium. We've actually put depression in with mental health disorders, but in this chapter we do look at delirium. So we look at delirium, we look at Parkinson's disease, we look at mild cognitive impairment, and also dementia. And there's a large section on dementia, and it really provides a lot of the current conceptual, or the way we conceptualize dementia care now, which has moved away from a medical model towards an experiential model. We talk about enabling environments, and the term that you may be familiar with, behavioural and psychological and behavioural, BPSD, behavioural and psychological symptoms of dementia. These have now been reconceptualized as responsive behaviours, because the symptoms of dementia are not regarded now as symptoms of the dementia condition, but rather as a way that the person who has limited communication can communicate unmet needs. So we really talk about a lot around managing and preventing and managing those symptoms, those responsive symptoms, as an expression of unmet need. And we provide frameworks, the understood frameworks about how to respond and work with people with dementia. As I said, there's also, you can see there in the tips for best practice, there are strategies for communicating with a person with dementia, and we specifically put that in because we'd heard that from students that they find that really confronting when they go into their aged care placements. So there's a lot in there around things that students can do, and practical guidance to build confidence. And the other thing is delirium needs to be recognised as an acute, a medical emergency. Actually, there are very poor outcomes from delirium. So we've really put a lot of focus in on delirium, on recognising it, on preventing it, and nurses working in all, acute care, residential aged care, need to be alert to the possibility that somebody, an older person who has vulnerabilities, doesn't take much for them to be affected by pain, by medication, by surgery, by a fall, by dehydration. Doesn't take very much for a vulnerable person to become delirious, and there are very poor outcomes. So we really communicate that strongly in this book. I think that's all. Lots of links to resources for the care of people with dementia too in this chapter, and Parkinson's disease we've looked at as well. This is an important chapter in this book because this chapter looks at relationships and transitions in later life, but it has a lot of information on elder abuse. We wanted to put a lot of information in here, not realising that that was going to come out so strongly in the Royal Commission. But so this chapter really talks about loneliness, transition into residential aged care, the importance of relationships, separation and divorce, the effect on older people. We talk about sexual and gender diversity in this chapter, but I would say we do have a whole dedicated chapter on cross-cultural nursing of older people. So yes, the cultural aspects are covered, but that's in another chapter. But this one's all about relationships. And of course, that's where elder abuse comes in, because so often it's occurring within a family or with a trusted person taking advantage of the older person. And we explain what the limits of mandatory reporting are and what are some strategies and approaches in this situation. So lots of again, tips. There's some tips there on how to talk to people. I'm just looking at the LGBTQI plus tips for best practice there. Just talking, how do you talk to someone who has that gender diversity and who for probably all of their life has felt perhaps that they have to hide that. They may have been disowned by family, they may have experienced stigma. So just some practical tips for how to communicate in a way that you can engage somebody who is perhaps reluctant to perhaps talk about their health conditions and various aspects of their life. So again, that's just some practical tips for students. So that's really our chapters. So we have the worksheets that Caroline explained, but we also have on each of the chapters, we do have some multiple choice questions that that you can use as educators for your students. And we also have, each chapter has PowerPoints to go with it, which pull out it has the learning objectives and pull out the important points of the chapters. Just to tell you too, there's a dedicated chapter to caregivers, supporting caregivers, which was written by Professor Davina Porrick. She's a nursing academic who's recently returned from the US and the UK, where she lived for many, many years. She's a very highly published nursing researcher and academic in this area. So she's written a chapter on caregivers. And our last chapter is all on bereavement and grief and supporting bereaved families before and after the death of an older loved one. So we talk, and that's written by Margaret Seeley, who is, she has a psychology and counselling background, and she's worked with Alzheimer's Australia in the area of bereavement care and palliative end-of-life care. That's her area of expertise. And she looked at the chapter from another book that we showed her, and she said, no, that's all old. I've got all the up-to-date current approaches, so that's in there as well. So I think we've talked long enough. Questions for us?
Thank you very much, Sue. We have had a comment come through the chat box with a question as well. I really like how you have conceptualized the book. How are you describing the conceptual framework that underpins the book?
Oh, Caroline, that might be over to you.
I would think that the conceptual framework, we've previously used other texts within care of the older person, and then there's been a little bit of health promotion, a bit of this and a bit of that. We've kind of used a person-centered approach in relation to this book, and every chapter relates to that one individual in the middle. So consider your older person, and we feel that every chapter then goes back to that person. And person-centered care is I would say, like the denominator of the book. There's chapters in there about how to navigate the system, because not everybody knows. There's chapters in there about seeing what's happening with the ageing population in Australia and in New Zealand. There's information in there about what's going on nationally, internationally within older people care. So yeah, I would probably say it's more of a person-centered approach with the holistic approach of the individual. And that's why we called it a holistic approach in the title.
I'm not sure if this answers the question, but we did start with chapters that really provide an overview of the bigger picture as well. So we looked at the healthcare system, we looked at the concept of healthy aging, we looked at the continuum of care. So the first sort of 8 chapters really are about that bigger picture, that this is the context of the current context of care. And then we started to look at the more specific areas, skin care, medications, falls, pain, hearing, vision, does that help answer the question as well? And then we finished with caregivers and bereavement to really round out that it's not just the older person, but also their family network and their social network.
How would you recommend academics who are on the call use this as a teaching resource?
I can start with that one. I think we wrote this as an academic, so bear in mind we started this just 2 or 3 months before COVID hit, and I was teaching units in the undergraduate curriculum at the time, and my speciality unit was older people. So I wanted a text that covered, and I didn't want a text that had been recreated from America. I wanted a Australian, New Zealand text that we could use, and that we explored every avenue of care of the older person in Australia and New Zealand. So that's why we started from scratch. We didn't use anybody else's text. We started with a fresh sheet. I wanted to make sure that all the components were there that I would want as an academic. So that's why we've got the chapters that you can divide up to, and they're easy reading. You know, there's no point expecting students to wade through thousands and thousands of words on a weekly basis when you say read chapter 8. You know, these chapters here will take half an hour to read a chapter. It's not huge. There's a couple that are huge, but some have got pictures in them. But the supporting material is the weekly worksheets. So you've got students targeting particular areas of where you want them to focus. So you can change them to suit yourself. Then we've got the PowerPoints that are there for you that you can jazz up and put in what you want as academics. So we've prepared all those for you as well. And we've given you multiple choice questions as well. So this is how I can see it being a text, and it could be a standalone if it suits all your needs.
Great, thank you very much, Carolyn. Just one final comment and question which has come through in the chat. A great text, congratulations. I'm interested in your thoughts about the neglect in residential aged care reported in the Royal Commission. You mentioned ageing as being a key driver.
Look, we can't change the aged care sector with one text. I think the systemic problems that have come out in the Royal Commission have been long-standing, and I think that's why the Royal Commission has called for a complete overhaul of the sector, beginning with the Aged Care Act, which, as I said, they recommended it's redrafted as a human rights focused approach. I guess if we can skill our nurses to be able to recognise and prevent deterioration, and so that our routine care is predictable and reliable and being provided as core business, that's where we can make a difference. But yeah, I think neglect, part of it is work. So the workforce is not appropriately skilled. There's also, I think, the ratio of nurses that, there's so few nurses and they're managing an unregulated health workforce, and I think that probably needs to change as well. So there are a lot of very systemic issues that need to be addressed. But this is our small contribution to try and skill our workforce to be able to recognise and prevent what we can, the deterioration and falls and those sorts of things.
Great. Thank you very much. So we just had a few additional questions come in. Is aged care a prominent feature of nursing curricula in Australia?
I can tell you, aged care tends, do you mean care of older people, I'm assuming? It tends to be integrated through the curriculum rather than a dedicated sort of unit in most universities. So I'm part of the Hartford Consortium on Gerontological Nursing Excellence, and they recently, or a year ago, I think, did a survey of all universities to try and see exactly what the content in the curricula are. It was very difficult to pull that out. Most of the care of older people is integrated right through the curriculum, and the placements into aged care, as I said, tend to be, oh yeah, you teach it as a distinct unit.
Yeah, and Lenore, we teach it as a distinct unit here, and we've managed to fight to keep that. Yes. So it's been fantastic.
So it'll be very interesting when they publish that survey, which will come out, because that's exactly what they looked for, to see how often it's taught as a distinct unit, and I believe it's not the majority.
The norm. It's certainly our EN transition to registered nurse students get this unit as advanced standing, so it would be really good because we understand that they do a unit in the care of the older person within the EN diploma, so that's excellent.
Our university has looked at a capstone unit in 3rd year to put the senior student nurse with a registered nurse in aged care, and I think that would be really good, because when they are working when they go in 1st year and they work with the support workers, they're not really seeing that registered nurse who's leading care and the assessment and care planning that they're doing. So that's looking at a sort of a 3rd year unit where they can do that, but hasn't been situated yet, but that's what we're looking at.
Thank you everyone very much for your time today. In the interest of time, we will wrap up this webinar. A big thank you to our incredible speakers, Dr. Carolyn Vafeas and Dr. Susan Slatyer, for your time today, and a huge thank you for the audience for dialing in. Thanks again, and I will close the webinar now.
Thank you,
Thanks everyone.
Thank you.
Thank you.